Long-standing issues in how 503B outsourcing compounding facilities are monitored have pushed the inspection system back into the spotlight. In fact, PSM studied the inspection records of 503B compounding facilities earlier this year, and we found that one that was shipping sterile implantable medicines that had never had an FDA inspection. Our concern deepened after two significant warning letters were issued in late 2025. The first warning letter, issued in September to a 503B compounder in Arizona, cited serious deficiencies in sterile drug production practices. FDA inspectors documented mold on a line used to produce bevacizumab syringes, which is a cancer medication that may be injected directly into patients' eyes. Just weeks later, another 503B compounder in Florida received a warning letter for failing to meet 503B conditions and for operating under unsanitary conditions while producing antibiotic eye drops and semaglutide injections. These cases are just an example of a larger problem, that 503B facilities can begin producing sterile drugs without a pre-production FDA inspection, and there is no required inspection schedule. As a result, FDA runs the risk of discovering unsafe conditions only after products are already distributed. The issue has only intensified with the explosion of GLP-1 drugs. Although compounding began during the national shortage, many facilities have continued producing these lucrative versions even after the shortage ended, often marketing them as personalized alternatives, despite not being FDA approved and the medical basis for this personalization unsubstantiated by actual medical research. Compounding was meant to be a last resort option for individual patients when commercial products could not meet their medical needs as determined by their prescriber. It's not supposed to be a profitable substitute for manufactured drugs. And this expansion has pushed some firms towards using unapproved ingredients or foreign raw materials. The result is a market where unsafely compounded and counterfeit versions continue to circulate through online sellers and med spas. In response, Representatives Yacom and Carson introduced the Safe Drugs Act of 2025, which seeks to modernize the inspection regime by requiring the FDA to inspect 503B facilities before they begin producing new drugs, mandating re-inspections every 2 years, and giving the agency the resources needed for more proactive oversight. The recent warning letters make clear that relying on after-the-fact enforcement is not enough. A stronger routine inspection system is necessary to prevent dangerous lapses before they reach patients, and that's why PSM endorses the Safe Drugs Act. Read our full letter of support that explains the issues at hand, and read more about the risks of compounding on our website at safemedicines.org.